Good afternoon and welcome to the weekly media briefing and public health update with Montgomery County Executive Mark Elridge. I'm Lorna Virgili, Hispanic Public Information Officer, and joining us today is Health Officer Dr. Keisha Davis, Dr. James Bridgers, who is the Acting Director for the Department of Health and Human Services, Mr. Sean O'Donnell, Program Administrator, Public Health, Emergency Preparedness and Response, also for the Department of Health and Human Services. And we have two special guests today. Catherine Durbin, who is the Director of the county's Alcohol Beverages Services, as well as Kelly Groff, President and CEO of Visit Montgomery. They're here to discuss travel, tourism, and entertainment activity in the county. Members of the media, for the Q&A portion of this presentation, just raise your hand right here on the Zoom chat, and this meeting is being recorded. Mr. County Executive, good afternoon to you.
Good afternoon, everybody. So I'm going to start off and thank everybody for joining me today. We're doing this press briefing a day earlier than we normally do because I'm going up to Boston tomorrow for a trip. More than 16,000 biotech leaders from 67 countries are gathering in Boston to find partners, investors, and resources to grow their companies at the annual Bio Innovation Conference. Though my visit up there is going to be brief, it's going to be filled with about a dozen different meetings. I'm going up tomorrow. I'll get there about midday, and I'll be leaving midday on Thursday. And in that time, I will have done these dozen meetings or so. Most of these are one-on-one with companies that are seeking to expand on the East Coast or organizations that support these companies. Because Montgomery County is the fourth largest cluster of life sciences companies in the United States, I'm sure I'll run into some of our local business leaders and organizations like FDA and NIH up there, as well as economic development teams from our Montgomery County Economic Development Corporation, Rockville's Ready, and the Maryland Department of Commerce. In fact, the Maryland Department of Commerce held a big event up there, I think just last night. I'm also looking forward to touring the Cambridge Innovation Center in Kendall Square to learn more about how they foster innovation through resources and placemaking. We have an exciting project, as you know, in the works in North Bethesda, the University of Maryland Institute for Health Computing. And I believe it's a kind of hub for the life sciences industry that Kendall Square already is. Kendall Square has kind of been a model in our mind for putting together the necessary components to build a true life sciences center. And Kendall Square is about 3.6 million square feet of office, retail, lab, hotel, and residential space centered around MIT, and dozens of public companies and accounting for hundreds of billions of dollars in economic development. So Kendall Square has kind of put together a model of an urban campus, and we're looking at learning from that as we look at how we build out our project in North Bethesda. Throughout my meetings, my message is going to be the same. Montgomery County has been the best place for biotech for a long time. Montgomery is going to continue to be the best place to start and grow these companies in the critical life sciences industry, creating jobs here and helping patients around the world. In other news, closer to home, you may have heard that last week, Montgomery County Health and Human Services Department leaders notified the public about a confirmed case of measles. While measles is highly contagious, it's also preventable via vaccination. Unfortunately, the majority of Montgomery County residents are vaccinated, except for infants under the age of 1, as they're not eligible yet for a measles vaccine. Pregnant women, infants less than 1 year old, and those who are immune compromised are the most at risk from serious complications from measles if they get it. The symptoms of measles include a fever of more than 101 degrees, a runny nose, cough, red watery eyes. Usually 1 to 4 days after the symptoms, a red rash appears on the face and then spreads to the rest of the body. A lot of people out there who are my age had that joyous experience when we were children. There were 5 confirmed measles cases reported in Maryland in 2019, but there haven't been any measles cases reported since then. So this is the first case in Maryland in 4 years. People are considered immune to measles if they were born in the United States before 1957 and previously had measles or have had 2 measles vaccine shots. So a whole lot of people in the United States got vaccinated early. I still remember as a school kid, the lineup for polio vaccines and, going to doctors for other vaccines, and they were widely available and everybody took them. While the window for transmission of measles has passed for this particular incident, it's a good reminder of the importance of vaccinations. The Public Health Department has been in contact with exposed individuals, and it appears that there has not been any spread. This is good news. This is a testament to the effectiveness of the vaccines and the importance of having high rates of vaccination in the community. This is not unlike what we do with COVID. If you're vaccinated for COVID, you're highly unlikely to attract a serious case of COVID. So vaccinations work. They've worked for a long time. And what's happening today parallels what happened earlier with polio and measles. It's also a peek into the world of our public health staff who track and investigate communicable diseases such as measles. And I really do appreciate their swift response to this case. On the COVID update, as for our weekly COVID update, our counts continue to be very low, and we're going to continue to monitor it, but there's been no dramatic change in our counts or hospitalizations over the last week, and that continues to be good news for us. The summer season will be in full swing in just a few weeks once school's out, and even though it may seem like the beaches have an advantage over Montgomery County during the summer months, it's important to remember how important tourism is to the local economy. In 2019, Maryland ranked as the #1 most visited county in Maryland with 9 million visitors. That left nearly a $2 billion impact on the local economy. And sports like soccer and lacrosse tournaments help contribute to Montgomery County's tourism revenue. The hotels, stays, and meals eaten on those trips add to our tax base. I'll add to this that, next week we'll be offering cross fines, which is our big attempt to create a wine processing facility in the Ag Reserve, which hopefully will give birth to many more wineries and over the coming years provide the basis for a real wine industry and wine tourism in Montgomery County. In the meantime, I'd like to welcome Kathy Durbin, who's the director of our Alcohol Beverage Service Department, and Kelly Groff, who's the president and CEO of Visit Montgomery, to talk a little bit about the strategy this summer to bring visitors back to the county.
Kathy, you want to kick us off? You're muted.
Kathy, please unmute.
There we go. Sorry. Hello, everyone. Good afternoon. I'm Kathy Durbin, Director of the Alcohol Beverage Services for Montgomery County. Today, I'm excited to announce the opening of a new ABS Gaithersburg Square store under the upgraded concept Oak, Barrel, and Vine, and that will be on Thursday, June 15th, right around the same time as the Crossvines opening as well. So we're really excited for next week. Throughout that weekend, the store will offer special tastings, including those of Maryland-made products, high-end spirits, and Juneteenth specials. Walt the Wizard Williams, a former basketball star at the University of Maryland, who went on to play 11 seasons for the NBA, will be present to sign bottles of his Clutch vodka. Also available, some rare and highly allocated items for purchase. The Oak, Barrel, and Vine branded stores feature handpicked items from with focus on spirits and locally manufactured products. The new Gaithersburg Square location is the largest of the ABS stores and the third to carry the Oak, Barrel, and Vine brand. It will feature a large tasting room, vent space, an improved selection of small format items, a dedicated non-alcoholic product section, queue lines for faster checkouts, wayfinding signs, enhanced customer accessibility. The LOC or local program has grown substantially over the past few years, providing local manufacturers opportunities for shelf space they might not have access to. So now Kelly Groff from Visit Montgomery is going to describe some of the things we do with the Montgomery County Tastemakers Trail in Montgomery County.
So good afternoon, everybody. Kelly Groff. In 2020, just before the pandemic, we launched the Tastemakers Trail. We had great timing. And it's actually we've been promoting it quite a bit this spring, and we have 12 wineries, 1 distillery, 2 cideries on the self-guided tour, tastemakerstrail.com. And I'm happy to say that on our website. It's the third most visited page. It's getting a lot of attention, a lot of interest from the New York market, and believe it or not, the Baltimore market. So we're really excited to also add crossvines into the mix of part of that Tastemaker self-guided trail. And I was here about a month ago to kick off summer with Discover MoCo Month, which was a big success. We had Shop MoCo Week, we had MoCo Hotel Week, MoCo Eats Week, and then our kickoff to summer. Travel's looking very positive. The hotels are excited about what's ahead. There's a lot of activity at the Maryland Soccerplex in Boyd's, which welcomes 1 million visitors a year. It's the largest generator of hotel room nights of any facility in the county. And we also have a lot of celebrations like Juneteenth, the weekend of June 17 to 19, Heritage Days, June 24 and 25, and then our farm tour, our annual farm tour and Heritage Festival, July 22 to 23. Visit Montgomery.com. You can go to our website, see the events page, and look at all the great things that are going to be happening this summer.
Thank you so much, Ms. Durbin and Ms. Groff, for your presentation. Members of the media, if you have any questions right now regarding travel, tourism, and entertainment activity in the county, this is a time to raise your hand to ask questions regarding that topic. We'll give you a second or two. No questions? Going once? Going twice? Okay, ladies, thank you so much for joining us this afternoon.
Thank you.
Mr. County Executive, we can move forward with the rest of the topics in the public health update.
So let's turn it over to our public health people.
Good afternoon. So a very brief update on our COVID tracking. We good news to share with you all today. We've seen a prolonged, extremely low rate in transmissions in our county, below 10 cases per 100,000 residents over the past 7 days. We're seeing low hospitalization rates as well, and these lower transmission rates are across the state. The low hospitalization rates are some of the lowest rates we've seen in the last 14 months. As we continue to track the different variants, the subvariants of XBB that are causing some cases in some other countries, it appears that our immunity to the previous strains is working very well and helping to reduce cases. Again, we still encourage individuals, if you have not gotten the updated COVID booster since last September, please come out and get it. If you've had that updated booster once, and you are immunocompromised or 65 or older, you can get a second one now. Again, it's important to keep our immunity levels up. We have no patients in our ICUs in Montgomery County with a COVID diagnosis, and only 11 across the rest of the hospital beds. Nothing further. We have not seen a death in Montgomery County in June yet related to COVID, and there's fewer than 10 deaths across the state for this month. So again, very good news on the COVID front. Again, we continue to offer COVID vaccinations at multiple places across the county. They are, of course, available from lots of the private sector, including personal physicians, pharmacies. Again, we're telling people since the end of the emergency, please check with your insurance or healthcare provider to make sure that you're going through the preferred method for coverage. They are still covered by insurance. You just may need to go to a specific person to get that. If you come to the county sites, we don't take any insurance for vaccination, so that's not an issue. And masks and test kits are still available at our libraries and many other places. That's all I have. Dr. Davis, did you have any other items you might want to add?
No, nothing additional. Thank you, Mr. O'Donnell.
Dr. Bridges?
Nothing to add. Thank you, Dr. Davis, Mr. O'Donnell, and Lorna.
All right, Mr. County Executive, we'll move forward with the rest of the topics.
Okay. We're done with topics. If people have questions, we're open for questions.
All right, so we open it up now for the Q&A portion of this presentation. Members of the media, you can raise your hand right here on the chat and let us know if you have any questions for the county executive and or any of the health officials. No questions? Going once, going twice. Guess we're done for today. Thank you everybody for joining us. Stay safe. We'll see you again next time. Thank you.